The final exciting thing that I'd like to share with you is a novel new treatment for constipation. Now, generally, when we talk of treatment of constipation, we talk about laxatives or the newer drugs such as secretagogues or drugs that stimulate gut motility. But this is a device therapy where you swallow a capsule, and the capsule has a vibrating device inside that, which then gently vibrates and oscillates inside the body, which connects with both the gut-brain axis and locally in the colon, activating colonic peristalsis. They had two primary outcome measures. One was increase of 1 complete spontaneous bowel movement, and then the second was increase of 2 complete spontaneous bowel movements per week. No drug or anything has previously ever used that as a benchmark, because it's a much higher benchmark to reach. But these guys were bold enough to proceed with that, and lo and behold, they reached that benchmark too. And it was like 11% in the placebo and 22% in the vibrating capsule arm. So both primary outcome measures were met, but that was the efficacy part. But the nice thing about this was the safety part. Literally no adverse effects, literally no adverse effects. About 10% of patients reported a vibrating sensation, only 10%, not the remaining 90%. But that was not strong enough or anything that said, oh, I don't want to participate in the study. No, they continued to participate in the study. They didn't withdraw from the study. But no diarrhea, no nausea, no headache, other things that we see quite commonly with a number of other pharmaceutical compounds that we all use. So this was really what we're seeing for the first time, a non-pharmacological, safe, efficacious approach using a capsule. Now, they don't have to take the capsule every day. It's 5 days a week. That's how the study was done. So Monday, Tuesday, Thursday, Friday, and Sunday. Remember, in Israel, Saturday, Sabbath day, so they don't take a capsule. I'm just kidding, but that was not quite true, but it was Monday, Tuesday, Thursday, Friday, and Sunday were the 5 days they took the capsule. And study was done in 95 centers across US, and it was very successful. So that was one of the important take home.
One quick question, and maybe, sorry, my roofer just drove up and he isn't supposed to be here till tomorrow, so I had to go deal with that. But are they pooping out the capsule? How do you recapture the capsule?
No, they just poop it out.
So you get a bunch of them. Yeah.
So they just poop out the capsules, and that's then it is not reused or anything like that.
Okay.
And it's
Wow.
so that was the main. Go ahead, Allison, you had a question.
This is amazing because we actually just had our colleague, Dr. Kimball, long time in practice, focusing on chronic constipation. She gave our audience a masterclass on chronic constipation and was exactly discussing. She was mostly discussing outlet dysfunction, which I know you did a bunch of lectures on that and treatments for, such as biofeedback, which we want to hear about in a minute. You did that at DDW, but she was mentioning that, there's a certain percentage of chronic constipation patients that it's like nothing really works for. And that is exactly what you began this article with, is that's why this was developed and who it's targeted for. And that's just really incredible news, because patients and doctors have been frustrated by this group we can't help. And this is incredible news, really.
Yes, thank you. Yeah, that is what I think it is. There is the survey after survey has shown that roughly half the population of constipated patients are dissatisfied with current therapies for various reasons: safety, efficacy, tolerability, predictability. These are some of the reasons that people have actually talked about. Whereas this one now probably gives them that little control, more predictable. It is clearly efficacious and appears to be very safe.